It's your boy ZDoggMD, aka Dr. Zubin Damania, and I have with me the legendary Dr. Harry.
Oh yeah.
That's right. Fists of Fury. Or Fists of at least mild to moderate outrage. So we weren't going to do a show today, actually, right? We were just going to hang out. Today's Harry's day off. He's a pediatrician.
My day off.
That's right. And you're in the Kaiser system in Northern California.
That's right. Mm-hmm.
And many patients very committed to clinical medicine, unlike this sellout over here. Okay.
I do practice medicine.
Only sees patients a few days a month. Mm-hmm. This guy sees him. Yeah.
You see patients still?
Okay, you can shut up right now.
Okie doke.
All right, this is my show.
All right.
Anyway, so we were eating in Redwood City because this is day off and I'm on this radical sabbatical. And we were talking about the show and what's the purpose of the show. And I told him the purpose of the show is to spread medical enlightenment among not just healthcare providers, but also patients. And he was like, well, you should talk about adverse childhood experiences. And I was like, what? You're an adverse childhood experience. I don't know what you're talking about. And then he started explaining to me how events in childhood, particularly stress and toxic stress, can actually lead to things that I care about, which are adult illnesses. And actually, you said something about the fundamental problem with our healthcare system being related to this.
I'm just saying that, I don't know how to fix the healthcare system. I'll be honest with you. I really don't know.
But I do, but I'm just not telling them.
One of the things that, we need to make sure about is that this is the type of a healthcare system that is able to deal with adverse childhood experiences, because it is a major public health issue and one that a lot of people are not aware of.
Yeah.
It should be, especially since it affects so many of us.
Well, I mean, if it's leading to chronic disease in adults, and chronic disease costs us 80% of our healthcare dollars, and it's accomplished by 20% of the patients or so, then if you can address the root causes of this, and it's a cycle, right? So if you have adverse childhood experiences, and we should define what is that?
Yeah, what does that mean? So
I got your comments here, people.
We're talking about adverse childhood experiences. We're not talking about I really wanted that Shogun Warrior toy and my mom didn't let me have it.
That was adverse for me.
Really
yeah.
Adverse. Okay, I'm not going to lie.
I wanted Voltron.
We're talking about stresses and trauma that is much more severe and also much more chronic. And so these are going to be things like abuse. Okay, so physical abuse, emotional abuse, neglect, dysfunctional households, such as even things as common as divorce, or having substance abuse issues in the family, or mental health issues in the family, or incarcerated caregivers or parents. Those are all things that affect children at a very, very deep level, and not just emotion, but really even going down to the biology and the physiology and the genetics.
Well, that's the piece that kind of interests me, because there's an effect of this so-called toxic stress. By the way, everything you described, incarceration, stress, that I call that the 80s for me. That was just how I rolled. That's why I'm such a thug right now.
Yeah.
I had a very nice, my childhood was actually reasonably balanced.
I've seen his family and his very nice home.
So have you guys.
Anyway.
But so the fact that it can affect something physiologically, biochemically, immunologically, is that data proven, or is this something that's just suggested in the data?
Well, that's a good question. I mean, let's talk about maybe one of the first really groundbreaking studies. And this was actually a study in 1998 done by a Kaiser physician actually named Vincent Felitti in conjunction with the CDC. And what he did was he actually did a retrospective study on about 17,000 middle-class Americans. And what he tried to do was it was a retrospective study, and he looked at whether or not there was any relationship between people who had experienced these adverse childhood experiences and the negative health outcomes in the future, right? And so, like as I mentioned, they primarily looked at things like abuse, right? So physical abuse, sexual abuse, emotional abuse, neglect, household dysfunction, divorce, incarcerated parents, substance abuse, mental illnesses. And what they found was that there was a dose-dependent, those who had more of these adverse childhood experiences, or ACEs, were more likely to have negative health outcomes and an increased likelihood of having 6 out of 10, or developing 6 out of 10 of the most common causes of death. Things like ischemic heart disease, strokes, emphysema, cancers of any type, and suicide attempts. those type of things than those who had not experienced any ACEs.
Well, so it's interesting because some of those seem obvious, like, well, suicide attempt. Okay, if childhood stress triggers, adult, mental stress or mental illness or PTSD or those kind of things, you could see that tying into maybe a suicidality.
Absolutely. No, and that's what I think most people do, is that most people think, well, that is so obvious. Why are you even doing a study like that?
Right.
Of course, if you had this crap happen to you, then of course you're going to be more likely to be depressed, and you're going to be more likely to do risky behaviors and smoke and drink and take drugs and things like that. And essentially you're driving yourself to all of these problems. And to some degree, yes, that is true.
So what?
Okay. However, even when you control for risky behaviors, okay, even if you look at the people who had a number of ACEs who did not engage in these risky behaviors, there was significant differences, not just in this study, but in subsequent studies, that they were at higher likelihood of having earlier mortality, problems with ischemic heart disease, cancers, and even things in childhood like asthma and eczema and more colds and more ear infections. Now, why should that be?
Well, so and that kind of ties into some recent data. They're looking at concentration camp survivors and finding that potentially they have a higher rate of cancer than a control match group. And the question is, was there some stress? Yeah, there was stress in the concentration camps. Was there stress that triggered an immune response or a biochemical response that put them at a greater predisposition to cancer? I've often talked about the mind-body connection being a legitimate thing, and it's nothing spooky. It's a simple fact of our physiology is affected by our mental states, our conscious states. So if you're stressed, it releases particular neurotransmitters, particular hormones, raises your blood pressure, changes your threshold for stress responses in the future, and that's going to change your immune response and all kinds of things that can relate to these then adult diseases.
That's right. I mean, so think about it this way. So stress can be a good thing. Right, we need stress. Stress is actually an adaptive thing that for what?
No, and I was gonna say we let's make sure we say that, because I don't want a bunch of millennials going, well, we don't need any more stress, so we shouldn't round in the morning.
We're talking about stress so this is adaptive stress. Okay, you are surfing in the ocean. In your case, you are floating on one of those big floaty things with a drink and something like that. Anyway, and you see a shark coming, right towards you. So your body appropriately activates its stress response, its fight or flight response. And that is a good thing, okay? That is a good thing. But let's say that you live on that little floating mattress and you're surrounded by sharks 24 hours a day. That is not so good.
That's called residency.
Yeah. I mean, to some degree.
Yeah.
I mean, it's like
no,
kind of a joke, but it's funny.
Yeah.
So that is
funny.
You're funny. So anyway, that is when it becomes maladaptive to have your stress hormones constantly activating, your increased cortisol levels, increased adrenaline, and that's when it becomes maladaptive. And some of the things that we've seen from studies is what this type of toxic stress can do, and it's actually pretty amazing. I mean, you can see from animals or rats or even children who have suffered stresses. You can see physiologic evidence on MRI of parts of their brains being affected differently. So they have enlarged amygdalas. The amygdala is the fight or flight, area of the brain.
Fear.
Exactly. You have, again, as you mentioned, when you have all this cortisol, the stress hormones, it can affect the level of inflammation in your body and your immune system, right? So you might be able to speculate, well, you have that much of the stress hormones in your body running all the time, it's going to mess with your immune system. You're going to be more likely to get infectious diseases. You might be more likely also to get things like allergies and asthma, which are in effect a malfunction of your immune system. And you might be more prone to autoimmune diseases, okay, which we see in kids and adults who have gone through adverse childhood experiences. So
it's pretty clear then from the data that you've reviewed, and this is a mini passion of yours, right? You're a pediatrician. I should mention. So he's a longtime pediatrician, went to Stanford Medical School, UCSF Medical School with me.
I did go to Stanford
for undergrad, and then did your residency at UCSF and then practice. So he has had a lot of experience with this, and I'd say it doesn't just go with pediatricians. Adult doctors see this as well and are passionate about it, like Wanda Filer from AAFP, who came on the show to talk about this as well.
And that's the thing with this issue, is that we call it adverse childhood experiences, but it is something which affects the entire spectrum of life, and so it really should be everybody's business.
Yeah.
Okay.
Well, so we can look at a few comments here. Mac says it depends on how resilient you are. Now, resilience is an interesting thing. So everybody from Brene Brown, famous sociologist, and others have talked about resilience. Resilience is multifactorial. Some of it is genetic. Some of it is how we determine our coping mechanism. Some of it is our social support. Some of it is the education that we get to develop resilience. So it's very difficult. Like, you could look at a child who's been through a concentration camp and comes out and becomes a successful entrepreneur and never gets sick and all of that and say they're resilient.
Right.
And the same child other child falls into a horrible illness, obesity, chronic disease.
That's right. I mean, all those points are right. But it is an excellent point, and it's actually where we as healthcare workers can really help to tackle this issue, right? Because fortunately, as grim as all of these studies are, children, adults, they don't have to be their experiences, right? Their experiences don't have to define who they are, and we also know that there are folks who are able to really surpass all the challenges of their adverse experiences, and partly it's through their resilience. And it's not just their own internal resilience, but it's a resilience that we as healthcare workers or as parents or as caregivers can really help to develop in kids and adults, right?
And how I'm going to get back to that. Don't let me forget. I'm going to take some comments, and I want to ask you, how do you help your kids who have some adverse childhood experiences or are currently going through it, or their parents? Because it's real easy to put a guilt trip on parents who are trying their best with the resources they have.
Absolutely.
Am I damaging my kids by giving them adverse experiences? Now, Dr. Harry says I'm going to give them cancer when they're a grown-up because I'm stressing them out now. Or is our divorce going to destroy my child's future health and give them diabetes? So you can see people would make those jumps based on what we're saying. But the argument is not necessarily, and actually a lot of it is how you frame it and how you manage that stress and try to create resilience.
Right. And I also look at it in a different way too. We're used to looking at individual health problems that come up now. Like, wow, this asthma is really difficult it's really kicking your kid's butt. What's going on here? I've given you a perfectly good medical regimen. Or why is your kid so overweight, and even since the last time I saw you, he's now twice as big, and I've been telling you about all this. And we look at these problems from that point of view without really and thinking, what's wrong with you,
right?
And not thinking more what happened to you.
Right?
I mean, that's really a lot, and we have to really ask that. We have to ask what is going on in your life. In fact, there's been times where you look at where we as doctors have looked and we see things on the growth curve. So we make a big deal about growth curves, right? And then sometimes we'll see, well, we got a kid who's growing along really well, and then all of a sudden starts plummeting, or starts really, really gaining a lot of weight. And you ask questions, and it's surprising how many times they will talk about something extremely stressful that happened, or even something that seems relatively innocuous, like divorce, or even or it could be the kid's dad was just released from prison and came home.
Oh, yeah. So you see all these things in the pediatric population,
right?
Honestly, I see it in the adult population, like stress on elders. Something big changes in the house, the elder decompensates, ends up in the hospital, ends up going to a nursing home, has a downward spiral, falls and breaks their hip. So it's not just children, but it's across the spectrum of age and continuum of life. I think that stress has these effects. Now, in children, it's tougher, I think, because you see this happening, and it's not it's never the child's decision. It's never the child's control, right? So here's a comment, Kirsten Black. Hospitalizations, painful medical procedures, chronic and serious illness, a parent sibling with a chronic or life-threatening illness, death of a loved one. These are medical ACEs.
Yeah. So let's be clear that they're beyond the types of ACEs that I talked about before, abuse and certain types of household dysfunction. There are a lot of other adverse childhood experiences that are increasingly being studied. And these are going to be things. An obvious one is the death of a parent or caregiver, right? Or how about the big, huge one, which is poverty? or a subset of poverty, which is food insecurity. You don't know if you're going to have enough to eat the next day, right? These are incredibly stressful and toxically stressful events or experiences that kids and families have to go through.
And the problem is, I think then it perpetuates a cycle. So then the children grow up in a certain way with certain diseases, with certain behavioral patterns that then they repeat with their own children, and this cycle repeats. So
that's absolutely right. And we see kids who have had a number of ACEs, and we look at their parents, and they too are survivors of their own ACEs.
And which gets to the point that you said, that if you're going to try to fix the healthcare system and society as a whole, you have to address adverse childhood experience, because it's the gift that keeps on giving badness.
That's right.
Generation to generation to generation.
And for many healthcare providers, that's a terrifying prospect.
Yeah.
Because honest to goodness, we're not trained to screen for that. And even more, let's say we are trained to screen for it, we don't know
what do we do when we find out
to do about it.
And you got 20 minutes to see the patient or less. There's a stack
That's
is backing up. You got to click the epic boxes. It's like, well,
when we're trying to get through a busy day, those are the questions we are trying not to
ask.
Right?
Like you can read between the lines.
I wish you hadn't told me that.
Yeah.
Because
now I got to do
somebody
something
else I need to talk to.
Right. Now, so we need better tools, better training, better capacity to respond to these things. Here's a comment. Tara Renee. I had a toxic childhood, and I'm struggling as a middle-aged adult with things I never would have imagined as an idealistic, bright-eyed nursing student back in the mid-'90s. Back then, I thought I had broken free and was making my own way. So this catches up, even as an adult, even when you think you've transcended it.
That's right. I mean, you have people who have gone through ACEs as children and have seemingly adapted to it, and have adapted. I mean, let's be honest. They get through it. They build strong friendships. They develop strong relationships if they're lucky, but that still doesn't take away from some of the early effects that ACEs have had on their physiology, on their behaviors, on their brain architecture, right? And it certainly doesn't stop them from then developing having the increased risk of developing autoimmune diseases and cancers and ischemic heart disease, right? Even if you have these healthy relationships, these are changes that have been happening since their childhood.
So, well, here's an interesting counterpoint. So Cynthia Wells says, managing society's expectations, we're conditioned that we shouldn't feel any pain. And so pain is the fifth vital sign, pay for performance based on pain control. We need to let people suck it up. So here's a feeling like, well, while we're talking about adverse childhood experiences, we have to make sure we're not going in the opposite direction and insulating our children from any real challenges or any... So in other words, let's make a distinction between what's an adverse childhood experience.
Again, that's exactly right.
Yeah.
Stress, challenges, these are actually good things.
Yeah.
Okay? And when it's adaptive, okay? We don't want to be in a position where we're shielding kids from every single type of stress so they never feel stress at all, because that does not work for them. It's not healthy for them. It doesn't promote their own ability to be competent in later life, or even in their current lives.
Elise Sidhu says, Dr. Harry has a nice kitchen. I want you to know something.
Okay, let's do a little break here. Go ahead.
Yeah. This is not Dr.
Fess
Harry's
up.
kitchen.
Fess
Okay.
up.
This is our rental house in the Portola Valley. Dr. Harry's visiting because he wanted to see how the other half lives.
You actually should have heard him complain. It's like, you know what, we have to slum it a little bit. This place is super rustic. It's like Abe Lincoln rustic. And so I'm thinking I'm going to be coming to like some little hovel. And then as I come in here, I'm like, this place is twice as big as my place is. Okay, so what are you complaining about?
Okay, having to live here is an adverse adult experience for me. All right, I'm going to go home with considerable gout and horrible side effects. Now, to finish her comment before you rich shamed me, she says, also, I think PTSD and stress disorders need to be more recognized outside of the military. As an emergency nurse, I'm 10 times more exposed to stress than my husband in the Navy.
Absolutely. Wow. And you make a great point. And this goes for first responders as well, right? We're talking about policemen,
EMS,
firemen, EMS. Oh my gosh,
dude,
EMS.
those guys, right? And their culture is suck it up.
Right.
Like don't talk about it. No. I saw somebody decapitated. I saw a dead child at the feet of their father who did a murder-suicide, and I was there for body recovery, and I can't say anything, and I can't tell my family because I don't want to bring it home with me. And It's horrible.
But yes, healthcare workers for sure, absolutely.
Yeah. My stress response is horrible eczema, chest pain, and I stop eating, says Heather DC. So everybody's stress response is slightly different. Let's see here. What about if the body is happy, the mind will follow argument? So Derek Wilson, if there's a mind-body connection, is body health influencing the mind? Well, I think this also goes without saying, right? That's why we find exercise helps a mood. Getting in shape or eating better makes people feel better mentally.
Right. The simple act of just smiling,
I refuse. I won't do it.
Smile.
I won't do it.
You have such a beautiful smile.
I won't do it. This is my frown turned upside down. Let's see. Carrie Hinchliff from the UK. As a result, I'm very self-deprecating, self-exploring. I have autoimmune Hashimoto's, anxiety, especially around my kids. A neighbor who abused me, seeing my mother dragged by her hair down the path by my father when I was a toddler, being kidnapped by a father, a stepdad who was in the French Foreign Legion and possessive and violent. So, wow, Carrie.
That, I can't even...
I can't begin to imagine.
And that, it also just goes to show, the study that I was talking about, the Vincent Felice study, also brought to light how common ACEs are. And their population is 17,000 middle-class people who engaged in this study. And this is actually predominantly Caucasian and predominantly college-educated. I think something like 2/3 of them had at least one ACE, which is probably not surprising. And in studies of kids nationally, just as children, probably 30 to 50% may have an adverse childhood experience.
Yeah, it's very prevalent, very prevalent. I could cite adverse childhood experiences left and right just for myself, and that was with really good parents and a good socioeconomic strata. Daniel says mindfulness is a good tool to manage stress. So yes and but. One thing to remember. Yes and but.
Yes and but.
This is a new thing that I've coined. Yes
terrible.
And but.
Okay.
It's yes and but. Mindfulness, especially concentrated meditation, has been known to allow the resurgence and the focusing on off childhood adverse events and memories and traumas that come back to the forefront, and now you are mindful of the trauma. And so sometimes you need a good teacher, or you need a counselor or therapist to help you process through that. Some people go on these 14-day retreats and they come back panicked. Yeah.
Yes and but.
Yes.
Okay.
And but.
You actually bring up a very good point, though, because we talked a little bit about, all right, let's say we do screen for ACEs and we find out about these ACEs. What do we do? What can we do? How do we help these folks? How do they help themselves? And amongst those things which help to build resilience is mindfulness.
Yeah. I'm a believer. Okay. Don't get me wrong.
It is mindfulness, and it's been done with some doctors in the area actually, with school kids, in terms of how to help them manage their stress, how to help them calm themselves, and just with really fairly short sessions in how to improve mindfulness, they're able to decrease level of depression. And engage them more in their school studies, and also even decrease their somatic complaints. Their feelings of illness, abdominal pain, headaches, et cetera, et cetera.
So this might be out of because we're talking about solutions now. By the way, Leslie Fullerton Passis says, "Thank you, Dr. Harry. Not what's wrong with you, but what happened to you." So it changes it from a victim mentality or a disease model to something of an experience model.
Or even a blame model.
A blame model, right? What happened to you, right? So what we're talking about solutions, there's a lot of ways you can deal with this. Now, one of the cutting edge research in adults with processing past adverse childhood trauma is the new emerging research in psychedelic, psilocybin, Mdma, these previously recreational drugs, and now they're studying them for looking at PTSD, trauma, people at end of life who are afraid of death, etc. Have you heard of any of this research?
No, I'm not familiar with that.
So it's interesting that, and this is just still preliminary, but sometimes they're doing guided psilocybin trips. So in other words, they'll administer psilocybin, which is a psychedelic related to LSD, also found in mushrooms, etc., for the recreational drug users. And they will put headphones on a person, blindfold them, and sit with them and talk them through the trip at very high dose psilocybin. So what they call an ego dissociative dose, where you actually lose a sense of self and all this stuff kind of resurges and you're talked through it. And they've had some preliminary, very positive effects from that in the guided setting with a experienced therapist. So
I might have a little bit of trouble talking parents into doing that for their toddlers.
So you just want you just give them a bag of mushrooms and be like, go suck it up?
No,
yeah.
We guide them.
Yeah, right. You guide them, right, like a camp counselor. No, but I mean, I think we should explore all the angles on it. Meditation is a key one. Mindfulness.
I would just start by this. So I mean,
you don't want to go right to mushrooms?
Actually, no, just because I'm not familiar. Yes.
You're dead to me,
but
yes and but. Yeah. So please continue.
Even if you don't have a ton to offer, I would say the simple act of helping to connect, your adult patients or your child patients or the parents, connect this, make the connection between these adverse childhood experiences and the types of ailments or issues that they may be going through today. It can be a powerful thing, because there are people who are really blaming themselves, like what is wrong with me? What did I do? And not really making the connection with, yes, this could really explain a lot of what's going on in my life. And that's actually a really powerful thing.
Yeah.
In and of itself.
I think that's spot on. Yeah.
But other than that, it's also about, when it comes to kids anyway, it is about like, okay, so your kid and you probably have gone through these adverse childhood experiences. Let's talk about what we can do to work through some of these, behavioral issues. So we talk about like child psychology issues, but let's also talk about how do we help you to become a more supportive and caring adult, because we know that one of the things which promotes resilience is having a supportive adult caregiver. Okay, and it's about how you help them parent, right? How do you help them? How do you it's also about like how do you manage the parents' abilities to cope with their anger and their frustrations so that it doesn't come out as violence, abuse
or
of
verbal
the child,
abuse,
or emotional abuse,
right.
et cetera,
right?
Because these are folks who likely experience this themselves from their own
almost
parents.
100%, right? It doesn't happen de novo, really. It's very hard. I mean, it happens, but having a perfect childhood, which doesn't exist, by the way. So
I never did get that Shogun Warrior.
Nope. And look at you.
Look at me
now. You wear hats.
And
I visit
palatial kitchens that are twice as big as mine and that are described as hovels. So
look, it's hard to socioeconomically relate to someone who's still wearing the same cargo pants that you wore in the 90s.
These cargo pants are really,
and
talk about resilient.
Yep.
You know what I'm saying?
They're full of expired EpiPens.
I don't know how many buffets these have gone through.
So a couple of interesting points. So Candace Hernandez, and I want to read two comments. Candace Hernandez says, I can't meditate or I get too stuck in my thoughts and anxiety and triggers a depression. But the counter, so Carissa Ziddick says, what I teach, which is at that time when you're starting, the mindfulness needs to be directed to simpler objects, smells, things around them. It's a constant redirecting. You don't fail, you notice that you're lost in thoughts and you come back to the object of your meditation. So that's why sometimes on a retreat, you can get into the deeper pains, but a standard mindfulness approach to being present in the moment, focusing on the breath, calming down, deep breathing techniques, and other things like Tai Chi, yoga. Someone quoted our song that we wrote together, Hippies. Aaron O'Shaughnessy says, mindfulness, attention to the now. I know, that's bad.
Okay, all right.
In case you guys don't know.
But.
Yes and but. Dr. Harry is often a secret ghostwriter on some of these lyrics. He makes them boringer, less offensive.
And still you manage to piss off
everybody.
Really perfectly nice
people. It's very nice people. No, they're not nice. They're very bad people, and they need to be pissed off. I'm sorry. They're super nice. Mental illness can most times be effectively treated with proper support. Evil can't be. It's a spiritual problem. Julie Craven. So I agree. A spiritual, faith-based approach was helpful for me, along with medications and a supportive husband. Now, everybody is different. So for some, spirituality and faith, whatever you're calling it, is a crucial part of the fabric of your recovery or your life, right? Yes. I knew a lot of people actually in high school who were sexually abused, who had a lot of difficulty at home, and they found solace in, it was Clovis, California, so it was the Christian church there. And they found a community, they found support, they found others who'd suffered like them, and they found a kind of resilience. So if that works, that's great. I think we actually need to expand even beyond that, right, in terms of our support structures, especially more secular support structures, which are missing. So it's worth discussing. Let's see, let's pull up some more of these comments. That 21 Pilots reference was sick, Adam Petrovich. Adam, you gotta watch Hippies, our 21 Pilots parody about mind body medicine. Not that I'm
Sick.
Not that I'm shilling.
Sick was a good thing in that comment, right?
It's.
I'm not up on the
it's like not
vernacular.
Not bad meaning bad, but bad meaning good.
Oh,
yeah.
I get you.
See, I gotta pay for this 1,600 square foot hovel, and I do it by selling out to big parody. Let's read some more comments. Heather DC, who commented earlier, counseling and medication and meditation help me. I've cut out a lot of abusive people in my life, and I'm doing much better. Awesome, Heather. Good to hear.
I need to cut out one extra abusive person in my life.
For the people on the podcast,
but I can't quit you.
He's pointing at himself because, his greatest enemy is him. You guys are good at arguing the devil's advocate. Clemens Cart Kimberly. What is the devil's advocate on this piece?
And who is the devil?
It's a good question. Mephistopheles.
Yeah.
The boy from across the river Styx. That chap. Yeah. What is the counter to this? That that adverse childhood experiences don't affect adults, or that we're overblowing it, or that you need some adverse childhood experience to be a tough kid, and maybe that's the problem with millennials, is they're not getting abused enough as a child. Is that any of your experience? I'm playing extreme devil's advocate because there's about 5 people in the audience that think that.
I tuned out on the question.
So the question really is, are we overblowing the ACE thing?
I don't think so.
Yeah,
I really don't think so, and I think it comes from just this very rich body of studies that have been really taking off over the past decade, which again, it stuns me to what degree, on a basic biological level, stress and toxic stress can have on our bodies, our minds, our behaviors.
Alan Salmi says the counter would be Nietzsche.
Oh,
yeah, well,
Nietzsche.
That's a Nietzsche I don't want to scratch right now. That was an adverse comedic experience because it was so unfunny that it actually hurt my future health. God forbid that you don't give millennials their safe bubble. Julie Santucci. What's your take on the millennial thing? Do you think over-coddled or under-coddled? What's the problem there? Is there a problem?
Boy, what can I say? I like many millennials.
My team is almost all millennials. I substituted you for 2 millennials.
You did,
yeah.
And you got a much better bargain.
I got Logan and Tom. Yeah.
But no, I think there is something to be said about that. I mean, it's a little bit about maybe part of it is also the kind of overpraising, the shielding from any sort of feelings of like defeat, and so you get rewarded for everything. You need to get a ribbon for participating. And I don't think there's something wrong with it. I just think that we need to be praising the right things. Okay, but that's a different subject. That's a different subject. Not about their achievements, or not about how smart they are, how beautiful they are, but by their effort.
Meritocracy. 3 comments. David Walpert. Parts of the country believe that therapy is not a real thing, just a waste of money and time. That stigma has to go. I don't know if it's parts of the country. I think it's just parts of society in general feel that way.
And certainly strong in many cultures.
Strong in cultures. Well. Absolutely, right. Tina Haler-Monsowitz says, I didn't learn about ACEs until I was in my 40s, and explains so much about the obstacles I had to overcome in my life. I'm praying I don't pass them on to my own child. She experienced a 9 out of 10 on the ACE score, which is really high. Just recognizing that this is a thing, I think, helps. Don't you think, Harry? Like, she recognizes that this happened to her. She's trying not to have the same thing happen to her kids.
No,
getting support.
That is absolutely the point.
Yeah.
Is once parents, for instance, recognize how it affected them, then they can be also empowered to make sure that they don't repeat the cycle with their kids.
Adriana Addison says insurance doesn't cover counseling much either. That's a barrier. Absolutely. Here's a comment on the psilocybin. Kenneth McKay, I worked through some ACEs using psilocybin. Not a pleasant experience, but I grew from it. Psilocybin is not a party favor. I concur. I concur with that. It is not a toy, but I think that it's worth studying these things as we decriminalize them to the extent that we actually study them for the therapeutic uses, because they do exist. I think we just have to figure them out. Now, what do you think of the whole medical marijuana thing? This is a side note. Don't you think marijuana should just be legalized and then we don't worry about the medical stuff? That's my take. I'm putting him on the spot.
Perhaps we should save that for
I'll save that. I'll table it.
Different talk.
Table it. You got lots of parents you have to answer to no matter what you say. You'll make some of them mad. I have no one to answer to except for God and this here really amazing tabletop. Look at this. Look at this tabletop.
This is
concrete.
This place is a hovel.
Yeah, it's a hovel. Guys, this is...
Anyway.
Did you want any... I was going to show them the Viking stove as a reward for sitting through this very intense discussion.
I guess so.
Let's do this, people. So, people have asked me about this Viking stove in this place we're renting. And you got to understand this, as a pediatrician, this is more than Harry would be able to afford with a lifetime of savings.
Absolutely. And it is actually burn proof, too. I could put my...
That was an adverse comedic experience.
That was acting.
All right, let's light some grills here. Let's see what we can do. All right, so we've got this. This one says rear. Rear. This is front. All right, here we go. There it is. Now let's turn it up to high. Oh my God. Look at the BTUs on that.
Is this how we're really ending this?
Dude, everybody loves a good stove.
Okay.
Right. You know, because,
you're right.
Nutrition.
All right.
Guys, it's been absolutely real.
Thanks for sticking it out.
Thanks for sticking it out.
For the lack of laughs.
We'll put a link into a TED Talk that's really good by one of Dr. Harry's colleagues.
Not my colleagues, but it was a really nice and pediatric.
Yeah.
Exactly.
So your
Nadine
colleague.
Burke-Harris. She's a great speaker.
Fantastic speaker. So we'll put the link in there. You guys can watch it. Hit share, hit like, spread the word. This is a podcast too. Go to iTunes and hit review on the podcast because it helps us a lot. And we out. Peace.